So today I have the pleasure of meeting with Dr. Aaron Saunders, and he is the Chief of Surgical Oncology at Loma Linda. He is also the chair of the International Committee of the SSO, and that's what we're going to talk about this afternoon. So Dr. Saunders, welcome.
Thank you. Good to be here.
Tell us about what some of the advances have been that the committee has worked on over the last few years.
In the last 15 months or so, we have added several new global partners, 3 new memoranda of understanding. All of these have been in sub-Saharan Africa. We've also led in some efforts of strengthening our relationships with existing global partners, and we now have 15 total global partner societies around the world. We've made some adjustments to dues for international membership, and that has seen an increase in membership from some of our global partners, most notably India, added several dozen new members from India over the past year. We continue to strengthen our programs for joint webinars and tumor boards and podcasts, and strengthen our interactions at SSO's annual meeting with bilateral meetings where we sit down and talk with leaders that form delegations from each of our global partner societies. There's a lot of exciting opportunity to continue building on our collaborative relationships with these global partners.
A few months ago, I asked the SSO staff to put up a map of the world to show which countries we have a relationship with, and it's pretty impressive. But what other geographic regions do you think are still relatively wide open?
We've had some preliminary contact with surgical oncology colleagues in South and Central America and Nepal. We also would love to see stronger relationships in Oceania, South Pacific, Southeast Asia. I think a partnership with the Royal Australasian College of Surgeons, which also has a surgical oncology subgroup, would be a great next step. And so we look forward to speaking with them more. As you said, the coverage we have, the relationships we have are impressive already, but there's more to do.
And what could the SSO do more with some of the longer existing organizations around the world? And one that comes to mind is the European SSO.
Yeah. We have a longstanding and good relationship with the European Society of Surgical Oncology. They have a large membership doing some really impressive things in the field. There are some established precedents for what the modern world allows in terms of virtual participation, shared content creation and dissemination, joint webinars, joint tumor boards, podcasts, things of that nature. But virtual participation is still a second-tier substitute for in-person interaction. What I think the European Society of Surgical Oncology and many of our other global partners would love to see is increased attendance at their meetings from membership of the SSO. So I would encourage our membership to be more aware of the excellent meetings that are being put on by our global partners around the world. If our members have been wishing to go on a trip to Europe or Asia and have some CME funding and time, this is kind of a great way to bundle some of that together, meet new colleagues, see what people are doing in the space of surgical oncology and other critical sub-areas of the practice in other parts of the world. It's often truly impressive, eye-opening to have an interaction like that. We can submit our projects and posters and videos to the other societies and share what we're doing here in the United States of America as well, and facilitate enhanced collaboration, enhanced dialogue within these global partnerships.
Well, I've had the opportunity to witness some of your work firsthand, and I really thank you and your whole committee. You've really done an exceptional job, and I think there's plenty of room for growth in the future, but you've certainly built the foundation for that.
Well, thank you. Appreciate it.